This demonstration shows how the powerful combination of Lotus Forms and Websphere portal can help modernize the new patient registration process for healthcare providers. Lotus Forms and Websphere portal can help healthcare organizations streamline the new patient registration process, making it faster and easier while increasing employee efficiencies, reducing wait times, enhancing service levels and improving patient satisfaction. The following demo illustrates key value points of Lotus Forms, including wizard-driven forms that guide the patient through the registration process, making the form filling process easier and faster. Real-time data validation capabilities that help reduce data entry errors, data re-entry, and invalid form submissions. Dynamic forms that include built-in logic that presents users with only the information they require based on previously entered data. Availability of electronic forms for viewing in multiple languages. Browser-based forms that extend processes outside the healthcare organization, beyond the firewall, enabling patients to register from their home or other locations. This demo also shows the power of Lotus Forms signature technologies and highlights how easy it is to create a security-rich, tamper-proof record of a transaction. The value of Lotus Forms enables healthcare providers to improve efficiencies and service levels, resulting in increased patient satisfaction and lower operational costs. Many healthcare organizations today are faced with a similar challenge of doing more with less. These organizations are often required to process higher volumes of patients with reduced budgets, all while maintaining top-quality services for patients. Currently, when a prospective patient contacts a healthcare provider to seek their services, the patient registration process commences with a staff member mailing the potential patient a package containing numerous paper forms. The patient then manually fills in numerous sections of the required forms and either mails the package back or physically drops it off at the healthcare provider's organization. The paper package is received by the healthcare organization. The office staff process the package and forward it to one or more appropriate practitioners for review. Once the healthcare provider has reviewed the form package, they advise the office staff to contact the patient to confirm their acceptance and or define next steps for their consultation. In total, this introductory process could take several weeks before a patient is even entered into the system. During this time frame, when the manually completed form is reviewed, if any errors or missing data is discovered, the office staff must personally contact the patient and the submission process starts over, causing further delays. The longer a new patient registration process takes, the higher the operational expense and the higher the likelihood for patient dissatisfaction. By contrast to the manual process described previously, the healthcare organization that automates their new patient registration process based on Lotus Forms is quick, efficient and devoid of errors. In this case, the patient contacts the healthcare provider via phone to express an interest in obtaining their services. The healthcare provider requests the patient's email and promptly sends a temporary access ID and password to the potential patient, allowing them quick access to the portal on the healthcare organization's website. The patient receives the email and within minutes can click directly through to the new patient portal portion of the healthcare provider's portal website, right from the comfort of their own home. The patient is easily logged into the healthcare provider's portal and is provided with access to the introductory information they require, along with an easy-to-follow set of instructions that guide them through the process of entering their data. Once the patient completes the introductory information and is accepted by the healthcare practitioner, they are provided with full online access to view their medical records via the website. The patient now has a secure and easy way to view and access their personal data from any computer. Now the patient can make payments and appointments and request additional healthcare services as required throughout their treatment. Let's see how this online process works for the new patient. In our scenario, Phil Garcia is registering as a new patient with the Theta Healthcare Clinic. He has received his user ID and password in an email. Phil logs into the new patient portal. Once in the new patient section of the portal, Phil is given clear status updates on the various forms he's submitted. By simply clicking the patient registration link, he is presented with the patient registration form using the Lotus Forms web form server. The wizard-style layout of the form easily guides the patient through the filling of the form and helps ensure they enter the appropriate data correctly to complete the form. The patient begins filling the form. Phil enters his name and address, He enters his SSN. Upon tabbing out of the field, a web service call is invoked which verifies that the SSN entered is valid. He clicks the Next button. Phil enters his phone number. The field turns red as a result of an invalid phone number. He is able to quickly correct his mistake and continue to fill the remaining fields on the page. Because Lotus Forms includes automatic data validation built into the form, it prompts the user to accurately complete the form and helps to greatly reduce the chance of common data entry errors and submission of incorrect forms. Phil clicks the Next button. He enters his emergency contact information. Once complete, the patient clicks the Next button to move to the next section of the form. The patient is prompted to add in their insurance information into the next section. When the patient gets to the question of whether they have medical insurance or not, they select yes. Based on their yes answer, the patient is then presented with a new section that allows the patient to enter their primary insurance carrier information. Once complete, the patient signs the form using the username and password for their portal account. After signing the form, the patient selects the Submit button. Upon submission, the data entered into the form is extracted and stored securely in the healthcare provider's database. The data is then available for reuse to quickly pre-populate the form shown next in this demo. In the New Patient section portal of the website, the patient can now confirm that their form has been successfully submitted. Now the patient can continue the next steps of their process by filling in the medical privacy form. The patient observes that their name, date of birth and ID number has already been pre-populated into the form by the portal application. Phil notices that there is a significant amount of text to read before he can sign the form. He feels he would be more comfortable reading the form in his native language, Spanish. Phil clicks on the language link provided at the top of the screen in Websphere portal. This triggers a reload of a Spanish version of the form. Once they have reviewed the agreement, the patient clicks the Sign button and enters their access ID and password. Lotus Forms supports multiple signing technologies and makes it easy for users to digitally sign any portion of the form, helping to create a security-rich record to address compliance issues. Once the form has been electronically signed, the patient clicks the Submit button. Now that all forms have been successfully submitted, the healthcare provider can easily review the completely electronic form package and directly contact the patient once the review is complete. Once the patient has been accepted and given full access to the portal portion of the website, they can log in to make appointments, pay bills, and check prescriptions among other services. This demonstration has shown the power of Lotus Forms and Websphere portal and how this combination can help to improve the way healthcare providers register their new patients, enhance service levels and improve efficiencies. We showed how wizard-driven forms guide patients through the registration process, how real-time data validation helps to reduce input errors, how dynamic forms only present information to the patient that is needed, support for multiple languages, signature technology that creates a secure, compliant, and tamper-proof record. In summary, the automation of a once error-prone, manual and paper-based process streamlines the new patient registration process, making it faster, easier, more efficient and less costly. Thank you for watching this video. Please contact your Lotus Forms sales rep for any inquiries on the information just viewed or other Lotus Forms related products.